Okay, I'm going to show you how to use the FDT visual field measuring instrument. So first of all, make sure the patient is seated comfortably and upright, preferably both feet on the floor. Have them turn and face the machine. Hand the patient the stimulus button and show them that they can click that button. All right, so they'll click that in response to seeing the stimulus. Once they're pulled up to the machine, you can adjust the height of the table using these buttons here off to your left. And to get the test started, hit the green button. The green button, you can keep on hitting it until you hit the home screen. This is the home screen here. You're going to want to hit the button next to Run Patient Tests. And then enter the patient's age. In this case, the patient is 27 years old. So I'm subtracting 10, it starts with 50, and I'm adding ones until I get to 27. All right, hit accept. And then the test we use is screening C20-1. Hit that button. And when you're testing the patient's right eye, slide this eyepiece over to your right. And then the machine will begin calibrating. Instruct the patient to put their forehead here and to hit the button when they see a flickering white and black lines. The white and black lines will actually appear in 17 to 19 different locations in their field of vision. The patient must look at the center black square. And the test will take about 1 minute per eye. Little map on the screen shows you exactly where the stimuli are being presented to the patient, and make sure the patient is complying with the instructions you gave them as they're taking the test. So this test is about 92% done. A few more seconds and we can go ahead and note we're going to test the left eye now. To test the left eye, you're going to want to slide the viewfinder over to the patient, over to your left as the examiner. Hit the button that says Screening C20-1, which is our standard test here, and the machine will begin to calibrate automatically. Once it's done so, the test will begin. Instruct the patient that the test has begun and that they should hit the button the same way they did with the right eye. As they proceed through the test, you can monitor their progress, encourage them to adhere to your instructions. And recall that they need to keep their eye on the center black square and only hit the button when they see the flashing, flickering white and black lines, so that we can get an accurate measurement of their patient's visual field. And once the test is done, you'll automatically get a printout of the patient's test results, and you can take the stimulus button from the patient, clean this with an alcohol wipe as well as the area where the patient's face was touching, and make sure you paper clip this to the patient's chart so it can be used during the eye exam. And that